the answer isn't always just increasing salaries, right? So obviously you have to have a great work environment. Um, you have to be employee friendly. And so really what you want to do is you want to have a core workforce, whether that's in person or remote, that you know is going to be with you.
Welcome to Off the Chart, a business and medicine podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. My name is Austin Luttrell. I'm the Associate Editor of Medical Economics, and I'd like to thank you for joining us today. Before we get started, a quick note. Physicians Practice will be hosting a Practice Academy event on March 19th, offering practical guidance for physicians and practice leaders on a range of business and operational topics. More details will be available soon. In today's episode, I sat down with Dr. Rihan Javid, a psychiatrist and co-founder and president of Edge, the remote staffing organization, to talk about how rising minimum wage and labor competition are reshaping physician practices, and why staffing pressures aren't as easy as just pay increases. We talked about why small practices and rural hospitals are feeling the squeeze first, which roles are hardest to replace, and how turnover quickly turns into operational strain for physicians. Dr. Javid also shares some practical advice on retention, budgeting for the year ahead, and why flexibility, including remote staffing, is becoming essential. Dr. Javid, thank you so much for joining us. Let's get into the episode. Dr. Javid, thank you so much for joining me today.
Oh, no, thanks, Austin. Good to see you again. It's been a few months.
So I guess we'll just jump right into the questions here. Nearly 20 states have plans to raise their minimum wage in 2026. From what you're seeing, how does that actually landing inside of physician practices and healthcare organizations?
A lot of physician practices and healthcare organizations, they run on very tight margins, especially rural hospitals, small physician offices. And so if all of a sudden you're raising minimum wage by 10, 15, 20%, um, which is usually like the minimum, right? In other states, they'll increase it by like $3 over a year or two. So that could be like 25, 30%. It can, unless a practice is planning it out and they've really thought about it, it can hit them pretty hard. Um, so we see like, maybe about 50% of practices have thought about it and they're implementing it and they budget it. And then the other 50%, including small rural hospitals, they just get hit really hard and they're like, man, this is destroying our budget. So it's an impact. I think it's great for the workers, the staff, they work really hard. Some staff will do the job of two people, three people, right? Like people get sick and there's no calling sick, right? You got 40 people, 30 people, patients coming in, and so you have to do that. So it's really great for them, but at the same time, unless the practice is really planning for it, it can be a big impact.
So I think, probably the big question is, when you think of healthcare, a lot of organizations already pay above minimum wage for most roles. So why are they still losing people as wages rise?
Yeah, minimum wage is not enough for healthcare. Um, I think a minimum wage, I'm in California, minimum wage here is like in the 16 and a half, $17 range. Minimum wage for healthcare workers in organizations of, I think it's 50 employees or more, is actually $25 an hour. And that's just the bare minimum. But, if you're a small practice or a rural hospital, you're competing not just against other small practices and rural hospitals, but you're competing against, here in California, the University of California health systems. You're competing against the state in Texas, University of Texas, Baylor, Rice. A lot of these places, they pay above minimum wage, so maybe it's only $2 or $3 above, but on top of that, you get a pension, you get a 401k contribution, and so all of a sudden, that in California, that $25 an hour minimum wage, maybe it's $30 plus all those benefits. That's another $5 or $10 an hour, and so all of a sudden, you're competing against people who are paying 35, 40, $45 an hour. And so it can become pretty prohibitive for small practices and rural health practices.
Absolutely. Um, when staff leaves for relatively small pay increases elsewhere, what roles do you see the practices are having the hardest time replacing, and why is that?
Yeah, it's I don't know if it's just one role in particular, but I think there's definitely some roles that are more critical than others. So obviously we know the patient-facing roles are really important. So if you don't have an MA to check somebody in, patients just get backlogged in the waiting room. They're not happy, and that leads, just the downstream effects of that. They're delayed. They become upset at the medical staff. Then they become upset at the doctor, and the visit just doesn't go as planned, right? So those are critical, and they're not always the easiest to replace. But a lot of practices, they say that the billing roles can be the most critical. So you can still see the patients, But if you can't submit the bills in a timely manner, you don't get reimbursed, and then you're having a hard time, getting revenue to pay your staff and yourself. And so, it's not really one role, but it's a combination of pretty much everything. But some of the more specific ones, like a billing, like a coder, claims submission, prior authorization person, those can be even harder to fill. But yeah, there's not, I would say, not one role. It's just overall, the roles are tough to fill.
Sure. So when practices might be having a hard time, as far as with staffing shortages, finding staff, retaining staff, they might respond by bumping pay, only to find themselves back in the same spot just a few months down the road. Could you talk about kind of what's happening in that process?
Oh yeah, all the time. It's so you increase your salary by $2 an hour. The guy down the street loses a staff, then he increases it by $2 or $3, and you got to increase it by another dollar. So it goes back and forth, right? So the answer isn't always just increasing salaries, right? So obviously you have to have a great work environment. Um, you have to be employee friendly, but at the same time, you got to realize that you're probably going to lose people to whether it's an extra dollar or $2 an hour. $2 an hour is $4,000 a year, so that's pretty substantial. So you can lose it to that. You can lose it to a shorter commute. And so really what you want to do is you want to have a core workforce, whether that's in person or remote, that you know is going to be with you, right? So say if you're staff for 10 people, you want like a good 4 to 6 people, probably six, really, maybe seven, who you know are going to be with you for the next 3, 5, 7 years. And then if you have like one or two or three that you transition out, that's okay. But if all of a sudden you're losing 6 people a year, 7 people a year out of 10, then I mean practice is not going to succeed. You're not going to do well. You're not going to, it's not just you're not going to be able to implement your current workflow and your processes, but you're not going to be able to grow and expand beyond that. So it's really important to have a solid workforce that you know is going to be with you over the long term.
Hey there, Keith Reynolds here, and welcome to the P2 Management Minute. In just 60 seconds, we deliver proven, real-world tactics you can plug into your practice today, whether that means speeding up check-in, lifting staff morale, or nudging patient satisfaction north. No theory, no fluff, just the kind of guidance that fits between appointments and moves the needle before lunch. But the best ideas don't all come from our newsroom. They come from you. Got a clever workflow hack, an employee engagement win, or a lesson learned the hard way? I want to feature it. Shoot me an email at kreynolds@mjhlifesciences.com with your topic, a quick outline, or even a smartphone clip. We'll handle the rest and get your insights in front of your peers nationwide. Let's make every minute count together. Thanks for watching, and I'll see you in the next P2 Management Minute.
What are the day-to-day operational problems that physicians are feeling first when turnover becomes a problem, even if they don't immediately connect it to, we're losing staff?
I think the physicians end up with more work on their plate, right? So that could be medication refills, where a lot of times the MAs do it. All of a sudden they're checking in more people, they're staffing more people each year, their staff, and so that stuff goes to the doctors and prior authorizations. Maybe the staff member was doing it. The billing, you're not getting reimbursed on time. So all that stuff gets pushed back, and a lot of times it falls on the doctor to take care of. And we've seen all of that, including billing, where the doctors are doing that sometimes.
So as practice leaders look ahead to the rest of 2026, uh, what staffing or budgeting assumptions do you think they need to have a second look at?
I think you have to have a flexible budget. I think that's the main thing. So you got to be like you got to look at the minimum wage, you got to look at the market wage, and you got to look at the living wage. I think living wage, market wage, a lot of times are the same thing in the medical field. So you got to see what that is for your area, and you got to budget that in. But I think you also have to be flexible and budget in pay increase for your staff, because if you don't do that, it's A, you're gonna go over budget, but B, if you can't offer people what they're worth or what they're earning other places, that you're gonna lose them, and then all of a sudden you're gonna end up paying more, because it's a lot cheaper to retrain people that you currently have, rather than you have to go through 10 different interviews to hire one person. And so you don't want to fall into that trap either.
If you had to give physicians one piece of practical advice on retention right now, what would that be?
I think you have to treat your employees well, and you have to pay them well. If you can do that, I think that goes a long way. And also, you have to be very clear with them what their job duties are. and that, we need you to do this, this, and this, and that nothing really comes as a surprise. But even if you do that, there's always going to be surprises. But I think it's just try to minimize and limit those as much as possible.
Sure. Um, I just want to go back to, so we talked about, bumping pay isn't always the answer there if you're losing staff. Um, I guess what is the appropriate reaction there? What is the appropriate response if people are leaving for a pay increase? I mean, what should you be doing as a practice?
Well, I think first of all, you got to look internally to see why people are leaving. Is it just because of the pay raise? That's one thing. I think that's fine. That's going to happen anywhere. But if there's internal problems, you got to look at that. And then I think you also got to look at your community. Are there enough people to hire to do this? And a lot of times the answer is no. And so at that point, you have to look externally, like what can you do to fill some of those roles? And a lot of times we're seeing practices are reaching out to remote employees both in the U.S. and as well as outside of the U.S., including, with us, we provide remote employees in Pakistan, Peru, Costa Rica. And so people are like, oh, I need 3 Spanish speakers who can do billing as well as scheduling and patient care. Um, so we're able to provide those. And so I think if you're consistently losing employees or staff, that might actually be a good idea is to get a core group that is going to be there for the next 3 or 5 years. Maybe they're remote, but they're able to do all those tasks. And then you just hire people who do the tasks where they're patient facing or they're, touching patients, doing vitals, checking height, stuff like that. So I think you got to be really flexible and you got to think outside of the box. It's not, pre-COVID days, not, 1990, it's not 2000, 2025, 2026, and you got to really plan for that.
Great. Those are all the questions that I have prepared. Is there anything that we didn't talk about that you think I might have missed?
No, I think it's really important for staff or for medical offices to realize that there's some roles that are very specialized, such as like a billing coordinator or a billing person, and you got to really see which ones you can handle remotely versus I think in person. And once you get, everyone's going to get turnover, right? So as you get turnover, you want to be prepared that can we move this one to more of a remote role and use some of the savings from that one to do this here. And so I think if you're flexible and you're able to move those, your funds around and your locations around, I think that tends to help quite a bit.
Great. Well, Dr. Javid, thank you so much for taking the time today.
Okay, thanks, Austin.
Once again, that was a conversation with Dr. Rihan Javid, a psychiatrist, co-founder and president of Edge, the remote staffing organization. My name is Austin Luttrell, and on behalf of the whole medical economics and physicians practice teams, I'd like to thank you for listening to the show and ask that you please subscribe so you don't miss the next episode. Be sure to check back on Monday and Thursday mornings for the latest conversations with experts sharing strategies, stories, and solutions for your practice. You can find us by searching Off the Chart wherever you get your podcasts. And don't forget, Physicians Practice will be hosting a Practice Academy event on March 19th, offering practical guidance for physicians and practice leaders on a range of business and operational topics, and more details on that will be available soon. Also, if you like the best stories that medical economics and physicians practice publish delivered straight to your email 6 days of the week, subscribe to our newsletters at medicaleconomics.com and physicianspractice.com. Off the Chart, a business and medicine podcast, is executive produced by Chris Mazzolini and Keith Reynolds and produced by Austin Luttrell. Medical economics and physicians practice are both members of the MJH Life Sciences family. Thank you.